morning. This is Shraddha Sidwani, clinical psychologist and psychotherapist from Mumbai. So today I would like to talk about sexual disorders. So why is this very important? In the age of increase in divorces and infidelity, I think one of the primary causes of these would be this inadequate sexual history with your partner. So when we talk about sex, we talk about the 4 stages, starting from your desire, arousal, orgasm, and finally the resolution. Both in men and women, we see across all ages and nationalities that these sexual disorders exist. In women, mostly they go ignored because the woman feels that either they're extremely drained in multitasking between family, home, and children and with work, or some women and men find it difficult to talk about their personal experiences. So, how do we address these problems? What would be the first point of contact? One is you could go to your gynecologist and do a complete evaluation, an andrologist, and if required, they may refer you to a psychologist. Now, some of the sexual disorders would be, one is your hypoactive sexual desire disorder, where you have a complete lack of desire for sex. You do not fantasize about sexual activity with somebody else. We have your arousal disorders, your erectile dysfunction, where men are unable to maintain their erection. We have orgasmic disorders such as the premature ejaculation, where a man would come faster than he would desire until the last part of the sexual activity. We also have sexual pain disorders where sex can be very painful in some cases. Now, what are the causes behind all these sexual disorders? So, primarily, we would, as I said, go to a doctor, reevaluate and see all the hormonal evaluations, physical parameters, if there are any, which may lead to these disorders. Sometimes there may be no physical parameter. There could be a comorbidity such as diabetes, which may lead to a sexual disorder. There could be depression or anxiety, which may lead to a sexual disorder. Once all these are kept aside and dismissed, then we look at conflicts between the couple or in a relationship. Also, sometimes in therapy we have seen there is a lot of anger, resentment, guilt and hurt between partners in a relationship, which may lead to disruptive sex life. It's also important to talk about what are the messages I have received about sex through my journey of life. So in childhood, what was I taught? Is pleasuring myself important? Is it a sin? Or is it normal biologically? Is sex about pleasuring myself or only giving pleasure to the other? Here it is important to note that as chocolates and food and friends may stimulate you, the sense of touch is also very stimulating to the human body. So don't ignore this. The first point in research is to come out, talk about any form of discomfort that you're feeling in your body. It's normal. The more you talk about it, the more you seek help, the more you will enjoy yourself and your partner and have a successful relationship. Thank you.